he asked us to announce or to tell something about, or one thought, just one thought about prevention. When he wrote us about this, I remember my participation in one of the past Onca Europe congresses in Copenhagen, where the theme was family doctors with heads and hearts. And I also remember the next one, the next European Congress, that is going to be in Bratislava, where the theme is general practice, human side of medicine. So this made a certain linkage with my own worries, my own preoccupations, and my own work inside general practice or in family medicine. And I remember the theme of one past congress where I participated some years ago in Lisbon, where we put this sentence: evidence-based medicine and emotions-based medicine. Are there any kind of contradictions, or what contradictions, if there are any contradictions, between these two areas of knowledge and of practice? The answer, I'm going to give it in the final. That will be my final thought about this. But in reality, the history of medicine and the history of general practice and family medicine and medicine in general are not is not so interdependent in the emotional part of the work and the so-called scientific area of our profession. And along the history, there is a scientific medicine, and there is also a dualism between the scientific or the science and the soul, the body and the emotions. There are separation between psychic and organic medicine, and psychic and organic illness too. And sometimes emotions felt by the patient and by the doctor in the consultation, they are not very welcomed, because they can, as it is a general thought, they can disturb the thinking, disturb the scientific thinking about the problems that are in cause, that are in the consultation, and they are not desirable that the doctor be interrupted in his scientific scientific thinking with some kind of emotions. But as we know, and mainly in general practice, in family medicine, in all human interactions, there are also always emotions. It is impossible not to immerse some kind of feelings or of emotions in human interactions. And the doctor-patient relationships is a human interactions. It's a human interaction with some inequality, because we are the doctors, we are the ones that are going to help to treat someone that come to us asking for help, but it is a human interactions. So there are emotions in the consultations, there are emotions in the doctor-patient relationships. But are there, those emotions are going to turn us more vulnerable if we think on that, if we feel that during the consultations? Should we put it there away because we are going to be more vulnerable and weak in our action, in our medical actions? But by the other way, are emotions a valuable tool for the diagnosis and for therapeutics? Are we thinking on that? And if yes, how are we going to make use of this emotional thing that happens in the doctor-patient relationship in order to help in a better way sometimes the patients? So our challenge would be allowing ourselves to heighten our sensitivity to what is happening, and our sensitivity would help us to go a little more in depth to the consciously and unconsciously areas of the patients, and with that to be able to help them better, because we are going to understand them more profoundly. So I think in the consultation we should be aware of these emotional resonances that the contact, the relationship with the patients put on us. There are some challenges here. The doctor should be or should get a sufficient insight about her own behavior and attitudes in the consultation. Perhaps this is one challenge that he has to learn from himself, from her attitudes, from her behavior through the patient. This would mean that he or she will be alert enough toward the interior resonances evoked by the patients, being able to deal without harm with the aroused emotions. And this without harm, I'm thinking in himself, herself, in the doctor, and also in the patient. This would be a continuous process, a learning process, enlarging the experience and capabilities for dealing efficiently with the so different types of people, personalities, and emotional attitudes. So I think this should be a worry of ourselves in our profession, to be able to confront ourselves and to confront the patient with this emotional area that would help to deal better and to better with the patients and to help them better. So my one thought about prevention is evidence and emotional based medicine are complementary. To learn to deal with ours and the patient's emotions would help us to be more efficient and accurate, preventing harm to others and perhaps to ourselves too, because we, with this, could prevent burnout in ourselves if we understand better the emotional areas, the emotional ambience that is in the consultation, and we confront it. So this is my one thought. I hope not to be very disruptive in this with what you propose to us, and thank you very much for listening.